Hi, good morning. My name is Kaedrea Jackson. I'm an emergency medicine doctor at Mount Sinai Morningside. I just left my house to work a shift this morning, left my husband and my 3 kids, ages 8, 6, and she would want me to say almost 4 because she's 4 next month. I think in regards to my kids, my 8-year-old definitely understands what's going on. He asked me about the coronavirus and what happens on my shift each day. My 6-year-old, I think he just enjoys being at home, so he's fine. And of course, my almost 4-year-old daughter she's okay. But one thing that they have noticed, even though the last 2 are not fully aware of what's going on or don't live, is that they definitely notice that mom's not at home as much. Mom's works a lot, and that's been stated. And it's kind of hard, but I think that's what's needed right now in regards from this pandemic, is that we need to be there not only professionally, emotionally, but physically in regards to making sure we're caring for these sick patients. I'm about to go in. First thing I have to do is I have to change my clothes in efforts to protect my family that I just spoke about. I actually change into hospital scrubs, a different set of shoes also, and then I was going to work clinically. At the end, I changed completely out of everything and then head home before I will take a shower when I get there. Everyone does it differently. I've known colleagues that I've actually chosen to move out of their homes to protect their family. And I actually considered it. I did initially separate myself and have my own little room, bathroom in my house, but it's hard. I think this whole situation's hard on everyone, and being separate from my family just wouldn't work for me, because they're the part that bring me joy, that would uplift me after a difficult shift. So this is what I choose to do. My shift today, we typically don't like to comment on the shift before or during in emergency medicine. You could talk always at the end, but I'll have to say, if it's going to be anything like what it's been the past few days, then the volume is definitely down. It's going down. However, the patients are sick. They are definitely have a higher acuity, needing to have more interventions immediately. So we'll see if that's what actually occurs today. So on arriving to the ER, I had approximately 18 patients in the ED. Only 2 were signed out, so 18 patients that were admitted. So far for the morning, it's just been a trickle of patients. The volume, like I said before, the volume has not been high over the past few days. Somewhat concerning, because we're just wondering, are our normal patients at home getting worse because they're scared to come in, or are they really, is everyone really okay? We're hoping that if someone's sick, they're not staying at home trying to avoid the hospital just because avoiding COVID. We're hoping that they're coming in, but we just don't know. But we just have to stay tuned, and we're hoping our patients do come in. So the ER hasn't been full as we're used to. Our typical volume is down. We're not having the same volume as patients come in. Since I've been here, I've had approximately 6 new patients, with possibly 3 of them are COVID related. Typically on this time, on this day, all of these bays will be full. There'll be patients sitting in chairs, and it's just not that way today. So we were blessed today with the fact that one of our local food places decided to, this is the company, decided to send us some food, send us some pasta. So it's really great. This is actually post after all the staff came. This was all filled.
Everybody's greedy.
And now it's gone. But it really does help a lot that we're not worried about food or anything like that.
Thank you very much.
Thank you. So this is the ER right now. Typically, like I said before, this is normally packed
all these rooms are packed typically, but right now there seems to be a lull. But when patients do come in sick, they are sick. We've had only 2 resuscitations today, but definitely I don't think it's a calm before the storm, because the storm did happen, but we are ready for when this storm does pick up. So I just finished my shift. It was not typical of a Saturday morning to afternoon shift. Definitely, I think I had at most probably 10 patients today total, and probably 3 to 4 were somewhat COVID related. The rest were due to the typical type of disease processes that we will normally see, which is kind of good because this makes us feel that our typical patients are coming back, because last week it was all 100% all COVID. So it's definitely changed. And maybe also with the fact that it's like 30 to 40% COVID related, that this is a sign that this pandemic is truly has plateaued and is now on the decline in New York City. Going to change my scrubs, then headed home. When I get home, I am going to immediately go and take a shower before I interact with my family. And I think that's what, like I said before in the morning, like everyone does it differently, right? There are people there are healthcare workers who are not going home to their families. They choose to stay somewhere else in the hotels. I need to see my family, just because they're my peace. They're what's going to keep me sane during everything. But I still have to take precautions to make sure that I'm keeping them safe. So thank you for joining me today. I wish I could shown you how it was when we were at our peak. But I want to at least give you a snapshot, an idea of what it is right now. Bye-bye.